I chose case 2 again. She came back to the athletic training room. She's still experiencing pain after we evaluated her the first time. She reports her pain to be a 2 out of 10 when sitting still and a 5 out of 10 when moving her shoulder. Our focus now is basically just to decrease pain so she can return to practices and games without worrying about her shoulder. We could also increase her range of motion. Since it's already been several days after her injury, it's no longer acute, so we can use thermotherapy. Whenever you're preparing a modality, it's important to assess for any contraindications. So do you have any impaired circulation?
No.
Do you have peripheral vascular disease?
No.
How about DVT?
No.
Any infections?
No.
Okay, so since she doesn't have any of the contraindications for thermotherapy, we can continue. We don't have access to an actual hot pack, but we do have a gel pack. So if you don't use a barrier between the hot pack and your skin, you'll have a high chance of being burned. So I'm just going to keep your shirt as a barrier between you and the gel pack, but since you do have a barrier, you're going to have to keep the heat on for about 25 to 30 minutes. That way it reaches the tissues and it has a greater chance of decreasing pain and increasing your range of motion. To measure the success of the treatment, when you're sitting still on a scale of 1 to 10, how would you rate your pain?
1.
With movement, how would you rate your pain?
3.
So her pain has decreased after the treatment. You could also measure the success of the treatment by measuring range of motion after this session and then after other sessions of thermotherapy. And you could rate the quality of life before heat and after several sessions of heat. Using thermotherapy for this injury would be beneficial for her because heat increases cell metabolism, leading to decreased fluid viscosity, and eventually that will lead to pain reduction. Heat also activates the descending pain control mechanism, which releases enkephalin, closing the spinal gate and aiding in pain reduction.